Hi, my name is Adriel William, and today's video is for all the individuals who are planning to go to a dentist school in the nearby future. And one of the things I wanted to tell you is that the factor that will shape your experience in a dentist school is highly dependent on what phase of life are you going to a dentist school, what age you're going to a dentist school, if you have a family with you or you're by yourself, or even if you have done clinical practice before, or you've been a dental assistant, hygienist, or you have worked previously in different jobs, all of these factors have already shaped your personality in a certain way. And when you're going through this learning process, the way you perceive it is going to be different. So, one of the things I would say, if you've been accepted or you look forward to being accepted to a dentist school, I will highly suggest you to go and start doing some kind of dental assisting in the United States. If you're outside of US and you have any capabilities to perform dentistry as a dentist, as a hygienist, or in whatever manner, try to get as much clinical exposure as you can. In US, I would say do dental assisting, because when you're in the dental school, you're going to be performing a lot of clinical work which would require you to prep your own chase, get your own radiographs. So you kind of like your own auxiliary. You're not just a provider, but you're also your own assistant, and you have to take impressions for plaster cast, and do everything pretty much. There's so much detail that I don't want to go, but I can tell you, I personally saw individuals who had done dental assisting in the United States were able to perform better in the clinic. So if you can do that, it would really help you. Second thing that I want to share is that if you are somebody who wants to score higher on the academic side, who wants to pursue a postgrad, or who wants to get some kind of distinction, I would say, in order to keep your GPA high or to score higher, the first semesters are more important, because that makes the chunk of your GPA. Because what happens when you start working in clinics? So here, actually, the way it works is, in the early start, you have didactic courses. So you're doing a lot of classwork and then lab work. And after that, your clinic starts. And once the clinic starts, you won't be able to, first of all, you won't have that many classes. And secondly, you won't be able to keep up with your grade that much, because you're also performing in the clinic and your focus changes to more clinical work, your patient care, and all of those factors. So the point I'm saying is that if you want to pursue postgrad or you want high scores and you want to keep up your GPA, make sure you take really good grades in the first 2 to 3 semesters, because those are really important before your clinic starts. After that, everything gets much more mellow and distributed. So it's not only focused on your academic, it's also focused on your clinical performance. One other thing that I wanted to share with you, I did a master's in health administration, and at that time, the culture of education, or I felt like the master's culture, was comparatively different. But in dental schools, what I learned even from professors who graduated about 30, 35 years ago and until now, they will tell you that the culture of dental schools in the US previously had a very authoritarian culture. Do what you're told and follow the rule. I I was talking to somebody who's in his 60s and about to retire, and he quoted these words to me, that the school culture always has been very authoritarian. And when you do something bad, it's not that you did a bad job, it also come across that you're bad or you're weak as a student. And that causes a lot of psychological stress. I'm telling you, it does exist. Even though the dental schools are trying to change their culture, but still that pressure and that stress exists. And that's why I shared in my videos that they will always ask you about, tell us about a time when you dealt with stress, because they want to make sure that you're somebody who will survive stress. So this culture will exist there. And what I want to tell you is, you have to be thick-skinned. And this was told to us on our orientation by one of our faculty, that be thick-skinned, that you are going to face a lot of criticism at time. You're going to be dealing with a lot of uh, pressure. You have to keep up with a lot of stress, and by the end of the day, you will feel that nobody cares. So be prepared for that. And I'm not trying to make it too dramatically miserable for you, but it is what it is. And on the other hand, if I can do it, trust me, you can do it too. The other thing is, I wanted to share, if you're going to a dental school, try to find your pace. Don't try to go too fast. Don't try to sprint in your clinical work. Don't try to, I would say, don't try to burn yourself out, because people do get tired. They think in the early start of clinic, in their academic, they're gonna be the gunners. They will try to do everything really fast and get ahead of everyone, but that will just exhaust you. You need to find your pace where you're not lagging behind in your work, but you're not going crazy, and you're not being over ambitious in school. If you want to be ambitious, yes, get good grades, go out and prove yourself in the real world. Because school is just a temporary phase that you go through to get your license. And what you do is you're doing bare minimum in school. You're not doing highly advanced kind of procedures. That's all it is, because you're working on somebody else's license, and why would somebody else jeopardize their license for you to become an advanced dentist? So what schools do is they teach you the basics, so you get your license and you go out and then do advanced things. And that's universally everywhere. If you go to a surgery training in Pakistan, they used to tell us, we will teach you not so you pass the exams and then you go do the bigger stuff. And it is what it is. So I would say, try to find your pace. Find your comfort zone where you're not burning yourself out, where you're not overstressed, because burnouts are real. That will happen. And actually, the word I wanted to use is burnout. You want to be careful about that. One other factor is, in your dental school, find people who can understand you. There will be times you need to have good friends, but along with that, even in faculty, professors, there will be certain people, certain personality types that you can associate with more. Maybe they are coming from the same background. Maybe they can understand your problems. Maybe they have gone through the same phase that you're going through. Because I know people in dental school who were 27 or maybe even 24, and then there were people who were around 42. So these people are coming from, these students are coming from different backgrounds. Not everybody could understand their issues or problem on the things that they are going through. So what I would suggest is, make sure you create your own niche. You talk to people and you find the faculty you're comfortable working with. And people have different philosophy about dentistry. So in the first early on months in the clinic, make sure you talk to people and find the people that you're harmonious to work with, because that will make things easier for you. Other thing I wanted to tell you is few things that you need to learn. Learn how to write proper legal notes, because when you're writing in US in dentistry, they say if it's not written down, it never happened. So whatever you're doing, the details of that have to be mentioned in your notes, because in future, if the patient sues you, that's going to be a legal note. And the school hammers you to do it. But it's actually a very, very good thing, because in future, you're going to be working on your own license, and people will love to sue you as a dentist in the United States. So I would suggest early on, learn to write good notes and learn to follow orders in the dental school. Do as what you're told. And the third thing is, try not to cry yourself to death when you're given criticism, because all of us in dental school, no matter how good you are, there will be one point where one faculty or one individual or one colleague will say something and you're already overstressed and tired, and it will make you feel as shit. and I'm sorry to use this word, but there will be a certain point. And most of us go through imposter syndrome where all of us go through this, and it's temporary, and you will just brush it off. So don't take it too hard. One other thing I want to tell you is that sleep matters. During my dental school, I've tried cold showers, I've tried exercising 5 a.m. I tried all sort of different techniques, different diets, nutrition. But one thing I felt which really, really helps you on a long term as well is getting good quality of sleep. And whatever your range is, 6 to 8 hours, 9 hours, but try to make sure that you get good sleep and you take the best care of your health, because that's really important. Other thing I want to tell you is that be organized in your work. I personally, and this is to a lot of candidates who were reaching out to me during the last year or so, and at times I wouldn't reply you. I'm really sorry. The reason I wouldn't do it because I was exhausted, tired, and at times I would feel that I won't be able to provide any constructive or positive feedback or response. So at that time, I just thought better not to reply, because I'm not going to be providing anything good or adding anything good to your life. And trust me, when you're going through the dental school, my words will haunt you, because there will be some times when you have so much going on and you don't have time to even talk to your friends or family. So one way you can overcome this is be organized, put things on auto pay, have the bare minimum baggage on yourself. And I think that's very important, emotionally, psychologically, financially. Try to keep yourself as much available as you can be for your school work, so you don't have to worry about money at the same time and other issues. I hope that will help you as well. And the last thing is, if you got accepted to a dental school, no matter how hard it is going to be, you will pass. You will graduate. If somebody like me graduated out of the school, remember, you will too. But the other thing I want to tell you is, don't try to outsmart the system. I've known people who were trying to play fishy, they were trying to cheat, they were trying to use unfair means, they were trying to trying to be over smart, and they actually ended up in a bigger problem than they should have. Because if you're not doing good, just talk to your faculty, give them a genuine reason why you're not able to understand, and they will help you. Maybe you will have to put extra time. Maybe you have to spend more time in the lab. Maybe you have to do some remediations, whatever it is. Tell them, talk to people, and they will help you. They will help you graduate. Be, I would say, expressive. Communicate well. Communicate on time. Think through what the problem is and be honest about it. But do not try to cheat the system, because people who were trying to do it, it ended up really bad for them, and it's not even worth it. So these are some of the suggestions I will tell you, that if I knew, I would have done better. But I presume you find this video useful, and hopefully I'll see you in a more meaningful video. All the best.